New data from Nova Scotia government show 142 Nova Scotians died by suicide in 2021, the highest number ever recorded in the province. We'll talk about that when we come back. New data from the Nova Scotia government showed 142 Nova Scotians died by suicide in 2021, the highest number ever recorded in the province. Joining me to chat about all of this is Dr. Simon Sherry, clinical psychologist at Crux Psychology and a professor in the Department of Psychology and Neuroscience at Dalhousie University. Doctor, I appreciate your time, of course.
Good afternoon, Todd.
Yeah, so very sad. What are some of the underlying problems here that are leading to this? What are some of the variables at play, do you think?
Isolation, confinement, unemployment, sedentariness. Our mental health has really taken a beating during this pandemic. Alcohol misuse, depression, child abuse, domestic violence, marital problems. We've been through the ringer over these last 2 years here in Nova Scotia and throughout Canada. This pandemic has really corroded Nova Scotians' mental health, so that's got to be part of the picture 2 years in. Keep in mind, though, a number like this, 142, didn't just emerge suddenly. We have been in the middle of a suicide crisis in Nova Scotia for some time. In fact, between 2000 and 2012, Nova Scotia had the highest rising rate of death by suicide of any Canadian province. And really, since that jump up over those 12 years, our suicide rate has not gone down, and remains alarmingly high.
And resources is key here, and it seems as though, like anything, we have a real lack of resources across the board in healthcare, but certainly in this sphere, I'm suspecting as well.
Resources are definitely part of the problem, and in particular, what's wrong here is science can guide the prevention of suicide. Suicide is absolutely a preventable problem, but what we know about suicide prevention is not yet being implemented in our province. For instance, when people attempt suicide, in the wake of that suicide attempt, they should be given access to psychological interventions and pharmaceutical interventions that are going to help them from going on to die by suicide. And in particular in our province, we need to implement what you call means restriction. And when you engage in means restriction, you take out of the hands of people who want to die by suicide the means by which they're going to die by suicide. So this can be very basic but fundamentally important changes, like taking away ligature points from jails and hospitals. These are places where people hang themselves. It can be examples like putting barriers on bridges that people are known to jump off of. It can be prescribing medications differently so that people can't overdose on them. We need to start implementing what we know about suicide prevention in our province to get that number down.
Is there information out there that people are accessing online as to how to commit suicide, and is that I'm sure it's out there on the web?
It's absolutely out there on the web, and you have to be careful what's put on the web and what's communicated through media, because there is an element of contagion when it comes to suicide. And so when one person dies by suicide using a particular means, that gets talked about and publicized, and that becomes a problem. We do have responsible reporting guidelines for mainstream media in Canada when it comes to suicide. The problem is in this day and age that news can spread so quickly over social media. So part of suicide prevention is making sure we're careful with what knowledge is released to the public, because there is, as you suggest, an element of imitation here.
So what type of action item list should the government be taking here?
We need to really pay attention to that means reduction already mentioned. We need to better train our family physicians and other gatekeepers on how to detect and prevent suicide. We need to improve access to care, particularly care that has been shown to prevent death by suicide. We need to seal the cracks that people too often fall through when they present to something like an emergency room or another part of our healthcare system. People fall through these cracks and they die by suicide. So we really need to help people transition from one form of care to another, from the emergency room to the care of a psychologist or a psychiatrist being one example, as opposed to having someone clinging to the edge of life present to an emergency room and then go to a wait list for weeks to months. There are absolutely multiple ways in which we can almost immediately begin preventing death by suicide in our province. What's really lacking at this point is a government-led initiative to coordinate these efforts and to energize these efforts with actual goals backed by real funds.
Yeah, absolutely. But again, resources are the key here, and you're not going to turn that around. We know that the Houston government's talking about fixing healthcare, and there's so many challenges that go along with that. So how do we prioritize this?
Well, let's talk about resources. When somebody dies by suicide, the cost to society is estimated at $2 million. And so if we want to look at this in cold and dispassionate economic terms, we're losing enormous amounts of money through death by suicide. We're losing the investments we make in citizens as we train them to be productive and contributing members to our society, and we're losing their future productivity. So even if we want to look at this from a resource scarcity standpoint, we're throwing away money by not preventing suicide in our province.
Yeah, I hear on a daily basis people reaching out to the show here and emails and phone calls. People saying that they've got chronic pain, they've got chronic issues, they're dealing with cancer diagnosis, they have very little contact with in many cases surgeons, with specialists, and they become completely and utterly hopeless because of it as they deteriorate. That's a real recipe for, I would think, for potential suicide, is it not?
Yes, it is. And among the various Canadians who are vulnerable to death by suicide, it is our elderly who are most vulnerable, especially our elderly members of society who have multiple medical issues. And it's often a man with medical issues in the later stages of life who dies by suicide in a place like Canada. That brings us to another point, Todd, that warrants mention in our province. As you said at the top of the show, 142 Nova Scotians have died by suicide in 2021. Of those 142, 106 of them were men. And so this is a problem that disproportionately affects men. In a place like Canada, in a typical year, about 70 to 75% of our deaths by suicide involve men. And this is in no way to downplay the significance of suicide to women, because women often think of suicide, attempt suicide, appear to emergency rooms with suicidal concerns more often than men. But at the end of the day, men seem more likely to die by suicide, mostly because they choose more lethal means like guns or hanging. So this is very much a problem among men in our society, and unfortunately it's also a serious and growing problem for Canadian women.
Any idea why this is affecting men more so? Is it the neuroscience? What's at play here?
One tendency and problem would be a reluctance for men to seek help. There are myths that men should stand apart, solve their own problems, deal with their own emotions, and that presents a barrier to seeking help from psychologists and psychiatrists who can provide potential solutions. So that barrier to help seeking is definitely part of the problem. Another real problem is just that men are more familiar with guns. They have greater access to guns. They're more likely to work in professions like policing that involve guns, or to have hobbies that include guns like hunting. And when you attempt suicide via a gun, it's a highly lethal behavior. In contrast, and not that this is in any way a good thing, but women will choose alternative means like overdosing. And you can definitely kill yourself with a drug overdose, but it's not nearly as lethal as using a gun.
So, some final advice to people who are going through some challenges right now. What are some ways? Who should they? What resources are there to reach out to?
Absolutely, and I'll speak not only to those individuals who are suffering, but also to those around them. If you find somebody who is thinking about suicide, show you care. Communicate that that person matters to you. Oftentimes an individual who is suicidal has a profound sense of disconnection from other people. So for you to reach out, be human, and offer that connection can itself be very important. Beyond that, we do have emergency resources like emergency rooms and 911. We also have a mobile mental health crisis line that is available to Nova Scotians. I would also really want people to appreciate that there are interventions from psychologists, psychiatrists, and other mental health professionals that help reduce suicidal thinking and behavior. And those interventions can provide people with real solutions to the problems they face. When somebody wants to die by suicide, often they have a strong sense that they're hurting so much that the only escape or solution is death by suicide. And I would want anyone suffering in that manner to know that there are other options, that there is help available, and I would encourage them to reach out and to fight to find that help.
Dr. Sherry, appreciate your time. Thank you so much.
I appreciate you drawing attention to this important issue, Todd.
Take care. Dr. Simon Sherry, clinical psychologist at Crux Psychology and a professor in the Department of Psychology and Neuroscience at Dalhousie University.